Heroin, a life-shattering drug of addiction, a presentation by Tricia Blackwelder. Heroin has several physiological effects. When using heroin, it enters the brain and is converted to morphine. The morphine binds to opioid receptors and binds rapidly to the opioid receptors. It triggers the reward system, leaving a rushing feeling of pleasure. The intensity of the rush is a function of how much drug is taken and how rapidly the drug enters the brain and binds to the opioid receptors. Heroin causes a blockage of pain by interrupting the messages transmitted through the nervous system to the brain. After the initial effects, users usually will be drowsy for several hours and may experience insomnia. Mental functionality is slowed and delayed. The heart function slows and breathing is also severely slowed, sometimes enough to be life-threatening. Slowed breathing can also lead to coma and permanent brain damage. Along with physiological effects, heroin also has several psychological effects. These effects are both short-term and long-term. Due to the euphoria feeling it provides, increased cravings form, leading to severe addiction. A tolerance is built up, leading to more drugs needing to be taken to achieve the rewarding feeling. Negative emotions and low self-esteem develop. Increased feelings of depression and anxiety are a result of taking heroin. Being high on the drug causes poor judgment, confusion, and disorientation takes over from the drug overpowering the brain. Side effects after the high wears off can cause mood swings as well. There are many biological influences in drug use, including structural brain changes, neurotransmitter changes, and also genetics. Biological influences on the use of heroin affect genetics, and addiction can also be a result of biological genes. It influences the development of the brain chemistry and development. Family history has a large impact on the influence of heroin use and addiction. Brain imaging has even shown the decreased volume of the frontal cortex in people affected by addiction, indicating less of a decision-making capacity. Psychological influences that can increase the risk of heroin use and addiction are more common in those that already suffer mental disorders, such as anxiety, depression, and bipolar disorder, to name a few. Those that have traumatic life experiences or events are more apt to turn to drugs and heroin to relieve their pain of suffering and generate a feeling of happiness. Those suffering from physical pain search for a relief. They are often prescribed opiates from the doctor and eventually become addicted, then turn to heroin because they are no longer able to obtain a prescription. The feeling of euphoria is so desired, the craving to use heroin intensifies. Research has long shown that a person's environment significantly influences their risk for addiction and relapse. A person's environment can include many settings, including home, work, school, society, and even social events. One of the strongest influences is home life and seeing parents or family members using drugs. To the individual, this indicates this behavior is normal. A stressful environment has a strong impact on behavior, especially for children and especially for those who have experienced trauma. Children raised in homes where traumatic events such as domestic violence, physical or sexual abuse, mental illness, neglect, divorce, or substance use took place are at higher risk of addiction. Individuals tend to follow what their friends are doing or surround themselves with those that they can relate to. Heroin is a highly addictive drug, and users of opioid prescription pills are 40 times more likely to become addicted to heroin due to seeking the same pain-killing and pleasure effects. Many users of heroin struggle to fight off their addiction. In seeking treatment, it is very common for an addict to relapse a few to several times before achieving sobriety. Due to harsh withdrawal symptoms, many individuals prefer an inpatient detox or rehabilitation center, so they are provided with additional mental and physical support. It is suggested that treatment for heroin addiction be medication-assisted treatment to help minimize withdrawal symptoms and curb the urge to use drugs. In the past, the only medication used for heroin addiction was methadone, which is highly addictive itself, but now other medications such as Suboxone, naltrexone, and a few others are available, which are non-habit forming. These medications help block the reward system if heroin is used so it does not have any pleasurable effects and diminishes the craving for the drug. Behavior therapy is strongly suggested once the physical side effects of the addiction has passed. The therapy will help teach new habits and behaviors to help reduce relapse. Along with the emotional and mental distress addiction entails, it also has many physical side effects. The withdrawal symptoms are so harsh, it is best to seek medical care when trying to detox. These symptoms can include nausea, vomiting, insomnia, sweats, intense cravings for more drugs, severe body aches and muscle pain, fever, diarrhea, heightened anxiety, and depression. As mentioned in the previous slide, the same treatments of medication, inpatient rehabilitation, and therapy will assist with the harsh symptoms of withdrawal. The Department of Mental Health and Addiction Services seeks the well-being for individuals. They provide information on local rehabs. DMHAS prevention and treatment systems aim to provide wellness and good health of individuals and communities by trying to prevent substance abuse and addiction. They offer programs for adults and youth that require recovery. They implemented a campaign titled Change the Script to reduce the amount of prescription drugs being used to help prevent substance abuse and addiction. They offer a 24/7 helpline that can be called at any time. Another resource is the Substance Abuse and Mental Health Services Administration, which is a national resource that has a 24/7 crisis hotline as well. They offer opioid treatment location centers near you. They offer recovery support as well as support and advice for family members of addicts. They provide referrals to local treatment centers and community-based organizations that can offer in-person support.